Hormone replacement therapy, or HRT, helps balance the natural hormone shifts that happen with aging, especially during perimenopause and menopause.
The biggest thing with hormone replacement therapy is optimizing your overall health.
As we age, we do stop producing as many hormones as we had in our younger years. So getting back a little bit of testosterone, estrogen, progesterone helps bring your body back into balance.
Signs and symptoms of a hormonal imbalance include hot flashes,
Night sweats,
Fatigue,
mood swings,
insomnia, difficulty sleeping,
decreased muscle mass,
hair loss,
and decreased libido. Our process is simple, so you come in for a consultation, undergo a quick office lab draw.
The lab results typically come back within a week, and then our nurses and nurse practitioner collaborate together to review your labs, review your individual symptoms, and develop a comprehensive treatment plan. The most effective way to balance your hormone levels is through pellet therapy.
get a steady state of the hormone that you need, not excess, that stays in the system for about 4 months. 4 repeat labs to make sure levels are where we want them. Review your symptoms, see if they've improved.
Pellet therapy is either estrogen, testosterone, or both, depending on your lab results and your reported symptoms. The pellet insertion is a quick in-office procedure with very minimal downtime.
People pretty quickly start to notice a change. You know, they're sleeping better, their irritability is less, their anxiety is less. People start to notice a little bit of weight loss. Especially for women, they'll notice that their efforts at the gym are actually working for them.
The benefit of using pellet therapy for hormone replacement is it offers a very steady release of hormones, and that optimizes levels over time and really continues to maintain an equilibrium.
When a patient heads out the door, we want to make sure that they feel really confident in the decision to be part of this practice.